Hi, I'm Tyson Franklin, and welcome back to this week's episode of Podiatry Marketing. With me is my co-host and friend, Big Jim Mack. How you doing today, Jim?
Doing great, Tyson. How about yourself?
I'm good. I learned an interesting fact from you before I pressed record, that if you're ever chased by a bear, run diagonally.
You've
Or
got
keep
me.
changing angles.
You've got me like second guessing it. Maybe that's the crocodile alligator thing. So I'll have to look it up once we get off the podcast.
I know, like I said there, I know crocodiles, if you run in a straight line, they'll nail you, because they've actually got a bit of speed when they get up and go on those legs. But if you change angles suddenly, then they can't change angles as well. So you reckon you made the bear thing up then?
I don't know. You had me second guessing, so I'll have to definitely Google it once we get off this recording.
That is so funny. I'm gonna check it out too. And then next week we'll let you know the real answer.
For sure.
Okay, so what are we talking about today other than outrunning bears?
Yeah, so we're going to talk about something a little less dangerous than bears or alligators or crocodiles, but no less controversial, I think, these days. We're going to talk about how podiatrists can adapt to direct-to-patient marketing. So, as some podiatrists are aware, there's at least one, maybe there's a couple more companies out there, primarily in the U.S. that no longer kind of markets towards. I mean, they might market a little bit towards podiatrists and to foot and ankle surgeons, but they're really trying to go the kind of direct to patient marketing route. And the biggest example of this, there was a TV commercial during the finale of The Bachelor about bunion surgery and made by a hardware company. This hardware company is obviously, they're directly doing that by making television ads, kind of marketing direct to the patient in that way. But also they're really known for having almost their own directory of surgeons. So if someone types in like bunion surgery Pittsburgh or bunion surgery Los Angeles, you won't get a podiatrist, you won't get a clinic, you'll get this medical device makers basically website directory of foot and ankle surgeons that do their specific type of bunionectomy. So it's not to say that their procedure isn't great. It definitely is something that a lot of podiatrists use, but just the way they're going about their marketing, it's important that podiatrists kind of understand this kind of strategic pivot by the advertisements. And we're so used to kind of direct to consumer stuff, but not so much in healthcare. So this topic is just to kind of be aware of what are some pros, what are some cons, and what are some ways to address this, because I think, like we've talked about in the past, Tyson, sometimes podiatrists see other podiatrists like as the competition. And it should be more collaborative. We both agreed to that. But, sometimes when a medical manufacturer jumps in and starts, marketing directly to patient, it kind of cause some different issues that podiatrists should be aware of.
So what you're saying, because I don't think that's happened here in Australia, is you've got a company that's made product X. And so instead of them marketing to podiatrists to say, hey, you should all use product X, they're going straight to the public and going, if you need this procedure done, product X is what you need to have used. And this is a list of the podiatrists that actually use it.
Yeah, so it's a surgical technique. It's basically
I think it's smart. I think it's very clever.
Their own kind of surgical hardware, screws and plates and those things. And it's got its own kind of trade name. So they're pushing this very specific type of bunionectomy to the public. So yeah.
So what's your opinion on it? Do you think it's a good idea or a bad idea? Like I can see the positives with the company making patients aware that they can get this procedure done, but I can also see the negatives where just because these podiatrists are using it doesn't mean they may be the best podiatrists at that procedure.
Yeah, I would definitely say that, old school podiatrists are kind of getting their feathers ruffled and definitely upset about it. I think it's pretty clever to kind of go down this road, but marketing in the U.S. and those things in business, there's trade-offs to some of these things, and I'll kind of go into the pros and cons of them. So some of the pros and cons, some of the pros initially are, it does definitely increase awareness of bunions in general when you have a manufacturer talking about it and spending millions of dollars or hundreds of thousands of dollars on advertisements. It definitely brings a broader audience to be to know more about certain podiatry issues. In this example, bunions, and that it is a diagnosis that does have certain treatments. So it can encourage people in general to seek a doctor's appointment, to get educated about it, and to seek professional advice. And otherwise they might have just thought that like that was something that they totally had to live with no matter what their pain level. So in that way, some general patient awareness is not necessarily a bad thing.
Yeah, no, it's just when you mentioned before about advertising on TV in America. It's one of the most entertaining things as an Australian to go to America, other than visiting a shopping centre or a grocery store. They are always entertaining. Just watching your TV, watching the ads that come on, the amount, it's like 50% of the ads are all medical and pharmaceutical procedures.
Yeah, and 80% of those commercials are the fast reading complications or side effects of said drug, right? Like you
Oh,
like
yeah. And I'll go, oh, I have this, rah, rah, rah. And by the end, it causes anal bleeding, does this, causes diarrhea, makes you vomit every 4 hours. And you go, why would anyone take that drug? It is incredible.
yeah, they're pretty. Some of those commercials are pretty wild.
But I can understand the thinking of it from their side. Like going back 20 something years ago in Australia, podiatrists, we could not advertise on TV. It was against the rules. Just weren't allowed to do it. I found a loophole. So I came up with a name for my orthotics, and they were called Pro Arch Foot Supports. And so Pro Arch Foot Supports is the other company I set up, advertised on TV about how awesome these things were, but you can only get them made at Pro Arch Podiatry. And that's pretty much doing a similar sort of thing. And I
Yeah,
did that 25, 26 years ago that I did that.
you're ahead of your time.
And then I did. I had the registration board say, hey, you can't advertise on TV. I said, well, I'm not. I said, but this company over here is, and they're advertising their product. You just happen to get it from me. And they went, oh, uh-huh. You found a loophole. I said, yes, I did. And then the rules changed 12 months later. Everyone could start doing it anyway. But I understood that process of marketing a product, the product is available, but it's no different to footwear companies do the same thing.
Yep.
So did I take you off track then?
No, like just ready to get to the next spot there.
Okay, go for it.
Yeah, so the next kind of pro I would say is that it does expand the patient base. If someone doesn't know that they had a bunion or the treatment was available, by kind of doing the direct to patient marketing, it definitely raises awareness about bunions or other foot and ankle problems. So that can be a positive. And last but not least, there is some kind of enhanced brand recognition, I would say. Meaning that podiatrists are more aware that patients are more aware that there are podiatrists out there to take care of their problems. That there wasn't one, single podiatrist that was, kind of talked about in that advertisement. Obviously when they do have the website that has their kind of preferred podiatrists that do their kind of specific procedure with their hardware. But like I said, it does kind of raise brand recognition for podiatrists when it's mentioned in the advertisement that they are experts. So, sometimes I think podiatrists, especially in the US, there's so many other people that try to take care of foot and ankle that, you need to kind of brand yourself as that foot and ankle expert. And by kind of directly marketing to patients in this way, it does help kind of the name recognition of podiatrists and foot and ankle surgeons specifically. So that there can be some marginal benefit from that.
Yeah, I can see there's a big positive because if they're saying product X and you see this list of podiatrists to get this procedure done, let's say it's a bunion procedure, they're not saying, oh, you can get it done at this orthopedic surgeon clinic as well. So it does promote podiatry a lot.
It can for sure.
So did you say earlier on though that some of the older podiatrists aren't happy with this?
Well, I think people prefer, the old way of marketing, is to kind of go talk to the doctors, right? Like, so basically,
Yeah.
if you have a medical equipment or surgical equipment, you go to talk to the doctors, you show them why it's kind of more technically superior or why it helps increase healing times, or you were talking to the person actually doing that procedure who's going to have to then talk to the patient about it. This kind of does an end around. It kind of bypasses that doctor. I think these groups or some of the medical equipment manufacturers will obviously have relations with the doctors, but it definitely changes that kind of. It kind of adds another person into the physician, and we'll get this as far as the cons go, but kind of adds another person to kind of physician-patient relationship about where they're getting their information from.
Okay. So yeah, that actually, well, do that again. That actually makes a lot of sense because, like you said, the guys there might be 3 or 4 companies that make different products for that particular procedure. They would rather have the patient come into them and say, this is what I think based on what I've seen, on my experience, not you've seen someone do a really great marketing campaign and now you think that's the best one for you, but it may not be.
Well, that's what we're going to get to here in the cons. That's a perfect, it's a
Okay.
perfect segue
Yeah.
as far as why this is not the best thing. What are some of the cons of direct to consumer marketing for podiatrists? So number one is, the risk of misinformation. I will say that while they did mention a little bit as far as the risks and potential complications of a bunionectomy, and the specific type of bunionectomy you have to do with their type of surgical hardware is usually, it does require some portion of non-weight bearing. And in a 30-second or 60-second spot, you can't really get into all the risks associated with foot and ankle surgery. So when you're getting advertised this kind of solution for a problem, there's a whole area that's kind of being left unsaid. So, it kind of risks for misinformation or for someone to have kind of unreasonable expectations after watching a 30 or 60-second advertising spot. So, when you simplify the messages, it can really, these unrealistic expectations and even outcomes and recovery times can kind of fall by the wayside, right? So that's one kind of con of, kind of going direct to the consumers, that you don't have enough time to really explain the risk and potential complexities of this type of procedure.
And is that why they run through the warnings at the end?
Well, they can run through the warnings at the end.
Contraindications, and they're so fast because it's just, they say them that quick because, okay, we've warned them, but the person doesn't really hear the ending. They're only seeing the shiny marketing side of things.
Well, but yeah, the shiny, like, here's the awesome result is going to be slow and kind of show you in a way that is positive, and they're going to rush the last 5 or 7 seconds of the commercial with some of the potential complexities or complications you can associate with any kind of procedure. So it's definitely a tricky thing.
And then I suppose it also comes down to, as long as they're not lying, they can get away with it. But then if one company does it, another company will start doing it as well. And they're going to try and outmarket each other.
No, it gets really tricky. Like you said, when one's doing it, the problem is that now you have kind of an increased demand for very specific treatments, right? Like I said, the one treatment that is, put out there is kind of a trademarked name for something, right? So you're going to get patients coming to you either in your clinic or maybe on a phone call, like, do you do XYZ procedure? And you haven't even looked at the patient yet, right? Like maybe they have great toe joint arthritis. Maybe they have some soft tissue mass that looks like a bunion. Maybe they have something else going on there. And, when patients are being insistent that they have this very specific type of treatment that was advertised, regardless of maybe there's something better out there for them, like I said, it can lead to tension and challenges in the doctor-patient relationship before you even get someone into the practice. And if they come into the practice and you're having to debate a patient about what the best procedure for them is after they've maybe bought into what they saw either through the website or the television ad or that kind of stuff about this very specific procedure, can lead to a lot of issues potentially.
Yeah, I can see the confusion because, as a consumer myself, I'll see something advertised and I'll go, yep, that looks absolutely fantastic. Then if I went somewhere to go and buy that product or whatever it was, and the person I went to buy it from was then trying to sell me something else, I'd be confused. As a consumer or the patient, I would start getting confused. Has the company lied to me that did the marketing, or is the podiatrist trying to get me to do something else that maybe they're going to make more money from?
Yeah, it adds a lot of layers of complexity too. It's like sometimes, maybe in the surgery center or the hospital where people do these procedures at, maybe they won't allow that one to be done, right? And you're still doing a great job with the bunion.
Okay.
So there's a lot of considerations when you're kind of advertising direct to the consumer.
So we have a company that markets product X, but the podiatrist might work in a hospital that does not use that. They've got a different relationship with somebody else.
Right, or they won't allow it, and there's it can be a really messy situation. I'm kind of been out of that game for 10 years or so when it comes to what you can bring into the hospital, what you can bring into a surgery center. But there's definitely purchasing departments and budgets and things that have to be considered when using different types of hardware surgically.
Yeah, this is definitely an American problem.
Yeah, we probably turned off all the UK and Australia podiatrists have already moved on to the next podcast, but I think definitely a lot of US podiatrists can understand some of these complications.
Oh, no, I think from like at the level you're talking about on the surgical side of things, I think Australian podiatrists are like, okay, that doesn't really relate to us. But recently, the amount of just products that I've seen for, hey, buy this thing and this will fix your heel pain. Yeah. Are you spending all this money seeing a podiatrist? All you do is use this vibration thing and it's going to work. And these things are just popping up all the time. So I think podiatrists are being faced with this, not just at a surgical level, but at all levels of companies promoting products. And then a lot of times they'll say, and it's been designed by a podiatrist, so therefore it must work.
Well, like you said, there's kind of some pressure that's kind of being put on some of these medical practices. I think the best example of that is that, if this company has a website that's a directory of the people that are doing this very specific type of procedure, and it's ranking number 1 or number 2 for very specific search terms, and they're willing to spend thousands of dollars on Google search ads or things to get that ranking really, really high, some podiatrists might feel compelled to offer or promote that procedure just because there's kind of patient demand. It's being influenced by this advertising rather than, they're making decisions based off of that and maybe what they've been trained to do best. Or, I think most podiatrists out there are ethical and they can do what's right for the patient. But, if you're getting a decreased amount of surgical cases coming to you because of all this competition from a million-dollar, multi-million-dollar medical device person who's advertising against you in a way, it can really affect, sustainability of your practice and put you in a tough spot because you want to provide, we take an oath as physicians of the foot and ankle to do no harm and to do the best by our patients. And it's one of those things where in this way, sometimes it feels a little bit in conflict if you're not, if someone's kind of end arounding you and usurping that physician patient relationship and kind of putting you in a tough spot. But I think there's different ways to approach it and kind of things to consider that we'll get back into in kind of the next section.
So is this happening? Have you noticed this happening more often in America, or has it just sort of started when it comes
No, I mean,
to
for a couple of years, I've
products?
run into issues when I'm not issues, but they've been competition in search results for quite some time in certain major metropolitan areas when you're searching for foot and ankle surgeon or bunion and podiatrist or bunion surgeon. You're gonna these device manufacturers are gonna crop up into the search, and most, like I've talked about in the past, like most podiatrists are gonna spend somewhere between maybe $1,000 to $2,000 a month in ads, and that's probably good. But if you're not, if you're making so much more money off of these procedures, like these medical device companies are, you can spend $5,000 or $10,000 in that local area, and then send them to your directory where people are going to, see that Dr. XYZ does this type of procedure. So there's a bit of competition with your marketing when you're when you're in an area that has these types of ads or these kind of surgeon directories that are kind of being led directly to kind of their surgeon partners, if you will.
Okay. Are there any other cons?
Those are the 3 cons. Yeah.
Yeah. Okay. What's the solution? We got
Yeah.
one?
So some of the solutions are, number one, patient education and kind of getting out there to kind of counteract some of this misinformation. Podiatrists really focus on creating and disseminating comprehensive educational content, both on their websites and, by doing marketing.
Yeah.
It's going to help potential patients kind of understand all aspects of the proposed treatments. Like I said, when you have a 30-second or a 60-second commercial, patients don't know what really get themselves into. So it's important that not only when they come and see you in your clinic, they understand risks, benefits of undergoing things like a bunion surgery, but if you have that kind of information visible on your website, when it comes to the risks and benefits of these procedures, it helps patients understand the totality of what it's like to get a bunion, right? It's not like you just go in, get the bunion chopped off, and they walk out the next day. Especially with a procedure like this, like I said, the one that's really aggressive with this kind of direct-to-patient marketing is, it's something that generally requires some non-weight bearing or very much protected weight bearing to let bones fuse. So, like I said, it's not a knock on their procedure, just you just can't explain it enough in a 30 or 60-second spot. It's really important that podiatry clinics kind of diversify the channels where they're at. Like I talked about previously, definitely website is a great way to get out more information there, but it's really crucial podiatrists to use a mix of marketing strategies. Online content through your website, community engagement is really, really huge. So if you can get out and talk to different groups in your local area, to other people that are in front of your ideal patients. And sometimes, like talked about, it's not always digital. Sometimes it is traditional advertising. If you're going for seniors, you want to make sure that you use a balanced approach that reaches the various patient groups that you want to treat. Sometimes, like I said, we've talked about this in previous podcasts, but if you're just kind of a one-channel person, you're probably missing out on all those other opportunities to help educate them about different ways of going about and treating bunions. Someone that is more elderly or less weight bearing, or there's, in a different stage of life, maybe that they saw, they have time to watch TV, they're watching The Bachelor final, and that's really not a good procedure for them. So, having information kind of being disseminated in other channels besides the ones that you're kind of seeing competition with is a way to help educate these potential patients.
Yeah, I like you said too earlier on when you mentioned that it's up to the podiatrists to actually start marketing themselves. They can't just sit back, let these companies do all the marketing, and then they don't have a voice to say their opinion, whether it's on their website or it's part of Google ads or whatever it is that they're actually doing, writing blog articles about it. But you said initially right at the beginning that this company was advertising on TV during The Bachelor. There's the problem right there. It's everybody who watches The Bachelor. You gotta stop watching that. Do you know, are they also doing it online as well? Are they doubling up, or are they just targeting TV programs?
Me being in Canada, I'm probably not in their market, right? So
Yeah.
if they're doing it, I would say it's probably on locations where they've already, built some of these directory websites. I haven't had anyone come to me, and I haven't done any research to see if they're doing it in any kind of US markets, whether it be YouTube advertising or other stuff. Maybe they are, but I'm me being in Canada means that I'm not going to be targeted for these types of ads.
Okay. Yeah, I assume if they're doing it on TV, they're probably doing it on other channels as well, which is why podiatrists need to be on more than one sort of channel as well.
For sure. The last thing I would say is, on this topic is that, we all, took the Hippocratic Oath in the US. We all, kind of in it to really give our patients the best possible care. So, just continue to focus on ethical marketing, right? So it's essential for podiatrists to, always put the patient first, do what's right by the patient, and you won't go wrong. And it's really important to have, a informed consent, this not just kind of, like you talked about, the 5 or 6 seconds they talk about the complications. You really need to make sure that when and patients, most of the podiatrists that are listening to this understand that, but you need to let them know, what the benefits and what the potential risks are of the procedure. Just being very blunt and honest about those things in a caring way is going to give them more reasonable expectations. If they just go by what they see on TV, they're going to be, I didn't know that all this stuff was involved. I didn't know infection was a risk. I didn't realize that, I had to be non-weight bearing or protected weight bearing for this many weeks. So it's really, really important that, you approach to help maintain the integrity of podiatry and the medical profession and really protect the patient's best interest, because at the end of the day, that's what's really most important. I'd say by understanding and integrating, these considerations into your marketing strategies, podiatrists are going to be better able to navigate the challenges posed by the direct-to-consumer approach. Like I said, I don't think it's all bad. It definitely gives some visibility to the foot and ankle and to podiatrists, but it is one of those things where if the surgical hardware company is driving the message home, they can't really provide the level of complexity and information that podiatry or patients need to kind of convey to potential patients about, the kind of high quality and patient-centered care that's really, really important. Because if they get half the picture that it's all, roses and sunshine, and the first time someone gets an infection, it's going to be bad. It's going to be a bad day for the clinic, but most importantly, it's going to be a bad day for the patient because they didn't have those reasonable expectations and risks explained to them. So I would say that, like I talked about, it's not necessarily the podiatrist that's the competition. Be aware of other people in kind of marketing to your patients, and make sure that you're being proactive in marketing ways that help you, provide excellent care to the patients in your local area.
Yeah, and like I said, this seems to be an American problem at the moment, not so much in Australia. But whatever happens in America usually happens everywhere else, eventually. So it may not be a company with a surgical product for a certain procedure, but there's going to be more and more companies, like I said, I've seen some online already, and I think this is going to happen more often. So I think it's really important for podiatrists to educate their patients, make them smart. If you've got smart patients, they'll make smart decisions. And like you said, always just do what's the best thing for the patient, not what's going to make you the most money. What's the best thing for the patient? I don't think you can go wrong.
Absolutely.
Okay, Big Jim, anything else you want to say before we wrap up?
No, I think that's good.
Okay. I look forward to talking to you again next week.
Sounds great.
Okay, see ya.